Why do we need an update for start of school? Something new happening?
No.
It's nothing.
Brandon.
Nicole,
Yes.
you were my ride home. Thanks.
Give you a ride.
I can give you a ride home, Connie. You're,
I offered.
I can give you one too.
You can walk.
it's not far.
Well, I do have my little shoes on.
Okay, I just got the thumbs up from Ben. We are going to go ahead and get started. Today is Tuesday, September 1st, 2020. Let's start by indicating who's here. Nicole, we're going to actually have you go first, and then we'll head over to Connie Anderson.
Nicole McDermott.
Connie Anderson.
Chris Wynn. Connie Burgess.
Todd Zenger.
Terry Bodden.
Martin Bates, Superintendent.
Karen Winder, Board President. All right, welcome here tonight. We're going to start. We're about a week, just over a week at the beginning of the most unusual school year ever. And so we thought it would be a good idea to have a little bit of an admin report on how that first week went. So we'll turn it over to Martin and his team.
Well, we'll start with Rick, and then Leslie, and then I'll come in with part 3.
Great. Test. Board member, superintendent, I have put together some numbers for you tonight.
That doesn't sound like your mic's
Can you not hear
working.
it? Test. Test. Now?
That sounds more.
You can adjust the volume over there.
But get right into it.
All right.
I can hear it through the screen.
1, 2.
There.
I can hear it on the screen, but. Just turn up the volume in here. Maybe unlock that control. Yell for now.
Just talk loud. I'll talk loud for now.
Well, the point is we can hear you
The stream can hear it.
and the stream can hear it.
So we're
good.
okay.
Yeah.
Okay, great. I put together some enrollment numbers, mostly just distance learning, face-to-face learning, and there's a mixed category as well. Mixed category meaning in high school, we have some students who have opted for some classes at the school and then some classes through distance. So I'll take you through that, just walk through the numbers. This first slide is just a summary of where we landed. I do want to note that this is as of last Thursday. So point being is these probably aren't incredibly different today, but we still will see some movement in these numbers over the next even week or so. Right now, enrollment size, 63,145. For a face-to-face option globally at the school district is about 75%, 74%. Distance learning, 25 and change percent. It's about 3/4 face-to-face, 1/4 is chosen distance.
Board members, I'm going to tell you something that's a little bit scary. Mike, you probably ought to listen to this. At 63,000 students, now we often don't have everybody show up, all the kids show up till after Labor Day. But that number looks as though we are currently about 17 teachers overstaffed district-wide. There are a number of schools that will be able to move people back and forth to. Nobody's going to be happy to have a teacher move from one school to another, especially not a teacher, but neither will the families there. You'll remember a few years ago how a school came and said, "You finally got class sizes where we want them. Now you want to move a teacher." And we said, "Well, yeah, because 19 when the neighbor next door is at 32 isn't a good deal." So I've committed, and board members, I think we're all committed that no teacher lose their position, that we not send anyone out the door. But that will be an additional expense into our reserves that we will cover as a board on behalf of our teachers. I know, Connie, you and I talked about that some months ago. We're committed to keeping all of our teachers employed. But our enrollment right now is down below the projection and what we'd staffed for. So, Rick.
what I've done for you is broken it into all 3 levels and categorized, and even given you by school the data. I'm not going to go line by line. I'm just going to work my way through each of them quickly. At the high school level, we average 75% face-to-face, 20% distance, and then this is where you see that mixed percentage. Mixed is not incredibly high, but there is a percentage of students who are opting for that modality. This slide shows you by school the data, and we range from 70% face-to-face to 82-ish% face-to-face. And you can see by school where they are right as of last Thursday. In the junior highs, it's really similar, not a lot different in terms of percentage overall across all junior highs. And then you see we range from 69, 70-ish% to as high as 88% face-to-face. So each junior high is a little bit different. One global trend that we're seeing is, when I'll get to some of it later, but we're seeing more students opting for distance in younger ages and younger grades than we are in high schools. We're also seeing some variance in where you live across our district in what percentage you are. So we're seeing some of our east side schools with a higher face-to-face percentage than we're seeing on the other side of the valley.
Rick, are the numbers identical for the high schools and the junior highs, or is that a presentation error on the summary page?
Yep, I'm just going back and forth. I'd have to double check, Todd, and I'll follow up with you.
That can't be that exact.
Whenever it's exact like that, I'm going to lean on my error on my data entry. But I'll follow up with you. I have an Excel sheet that I think I included in the packet as well that I'd refer back to, and I can tell you. On elementary schools, there's 3 slides worth of elementary schools where we show each school. Again, elementary schools have a lower face-to-face percentage than we see in the secondary schools. But across those, we range anywhere from the 50th percentile up to into the 80s. So here's where we see probably the most distance learning option selection is in elementary school. And you see there's no mixed learning percentage in the elementaries. This is kind of a secondary option that you see just because of the nature of 8 periods, or multiple periods, I guess I should say.
So, Rick, one of the concerns I visited with Hillsdale, that number's pretty high at distance learning. And the principal was quite surprised, and I was too, on some of our west side schools there.
Terry, pull down your mic so online people.
Sorry about that. Are we seeing struggles with parents online and the kids really learning the way they need to, or have they been able to weed that out yet to see if the kids and parents are really progressing the way they should?
That's a great question. And the answer for that is difficult, and it depends. One of the conversation that we're having, conversation we're having with the association right now, it's ongoing, and we're working that through, is how to help teachers, elementary teachers in particular, who are teaching in both modalities, how we can help them have the support so that they can give support to the distance kids in that instruction.
Yeah, because I'm afraid parents aren't going to give them the support they need. They want to, but I'm concerned with the language barrier.
Yes.
It's going to happen.
And so there's that piece where the teachers are teaching both modalities that we're struggling to address, and we're, as Karen said that a minute ago, we're 7 days into this strange year, and we have not worked the bugs out there. I think a lot of people heard from a particular parent today, to include state board members and others. We're working there where we can individually. Now, to the parents, we have not yet been in this long enough to be able to track how many kids have signed on or have not signed on. But that's going to be something that we're very interested in. You'll recall in the spring, there were 20% of our kids that never signed on distance, and there were another 15 to 20% that signed on a couple of times, but then we didn't hear from them again. And so we're watching that very carefully. But I think it's premature to be able to give you a good answer to where that resides right now.
Well, and we lost almost a half a year last year of real good learning. So I think that needs to be something that we really make emphasis with, especially on our ESL kids and you know, those that are struggling with language, because if they struggle understanding, the parents will also.
Yes.
So I think we need to really be on top of that as quickly
Well,
as we
and
can.
Leslie's going to break her neck nodding so hard, because that's.
We're solving that right now currently.
Okay.
I know that Ed Equity has reached out even for technical support to families, so if they don't have language with Chromebooks, et cetera, they've reached out in their native language to help walk them through those kind of things. And I know that's happening.
Okay.
Now, just to follow up to that, Martin, I don't want to kind of get ahead of the presentation, but I do want to make sure, because I've heard from a lot of teachers teaching dual modality, about where do they put even that half an hour or that 40 minutes or 45 minutes, you know, kind of a time slot that the kids know that they're available for face-to-face and questions and for parents and students. Is somebody addressing that later, or is that a good question for now? Because my big concern is, you know, getting feedback from teachers saying, I can't do 2 jobs for the price of 1. And I know we've all read that in emails. And there is a fair amount that admit it's not exactly a 2 for 1. It might be 1.5 to 1, you know, because they can use some of the same materials. But the fact is that they still need time away from their in-person class to connect with those distant kids. So this is kind of a little bit what Terry's getting to. So my hope is that we're providing those dual modality teachers, especially in elementary, is where I'm hearing the most feedback from, that we can get like a committed aide in there that's at the same time every day, same aide, same class, so that teacher can train his or her class. Hey, distance kids, this is when I'm available. Does that make sense? So can you address that a little bit? And then Connie, did you have a question after?
Well, and I have visited all my schools, and in talking to like principals like Afton Lamson, his teachers are using the online stuff, curriculum stuff, the district put on Canvas. And I think the question we need to be asking is, are teachers using that? Do they know how to use it? Because the ones that are using it love it.
Yeah, and I agree. I've heard that too. I've heard a lot of gratitude for all the work that's gone into that. I just, you know, logistically, I'm wondering, are we communicating to our school principals to come up with some kind of you know, where we're utilizing those paraeducators that are good to step in and help out? So that's just a piece of feedback that I wanted to bring back to you guys, because that I'm hearing that loud and clear. And I agree, Connie. I it's not that I don't think that a lot of work to support our teachers haven't been done, because I know that you guys have worked on Canvas and curriculum and prepared a lot of stuff over the summer. So I don't want to sound negative here, but I do also want to make sure we're having supports for the teachers.
The short answer is yes. We're working on that. The long answer is we can do some things that'll cover 80% of the situations, and then we can do additional things that cover another 10% of the situations. But those last 10% are going to take a lot of hand-holding and some resources that we're prepared to commit. But it's going to take a little bit of time to get through those. And like I said earlier, that's something that we're working with the association hand in hand to get all the way to the end of the row. That's a huge concern on behalf of our teachers.
I just don't want to burn out our teachers in the first 2 weeks because they're trying to
Yep.
put so much extra into it, which, we're grateful. We have some of the best teachers in the state. I'm grateful for them, but I just don't want them burning out.
Yep.
Yep, and the challenge of that being, superintendent's right, we're working through that and having some discussion with GEA as well. And the challenge is balancing parent need with teacher need and trying to find that Goldilocks spot for both. We are working on it, yeah.
Okay.
The materials, I do want to say, I think that worked well. Our strategy for summer to have things for first quarter are there, but transparently, I want to be honest with you, board, we are only 1 quarter ahead of what we are. So right now we're scrambling to try and put together some materials and things to support quarter 2. And we're just going to try and stay 1 quarter ahead with that. So curriculum and instruction have done a great job with that and involved a lot of teachers as well. We're a little bit more thin on teacher help with that right now because it's not summer. They already have a job. So we're working on that. Todd Leslie helped me out with my error of transcribing numbers in junior high. She brought up to me the spreadsheet where 73.41% face-to-face, 25.44 and 0.44 in distance, and 1.14 in mixed. So fairly close, but that was a trend. I copied it over twice.
You can't get 4 when there isn't one above 2. So. Thank you.
Can I
Yep.
ask a quick question?
Nicole, go ahead.
Hi, Nicole.
So I know at least they do have mixed learning. Is that, I'm not sure why that's not reflected. Like they're going for the DLI. Entries doing that.
Yeah, we do have a little bit of DLI where a student is only coming for the language portion. Why that is not showing in this data is we're just recording it one way or the other. Elementary, how we record isn't split into classes like secondary isn't split into periods. So we are forced to just pick marking those students as either distance or face-to-face rather than having that option in our attendance records to mark them as both. That's why you don't see that group. My understanding is that's really probably a dozen to 20-ish kids that are opting to do that. Did that answer your question?
Yeah, thank you.
So elementary numbers, several slides through those. Specialty schools I included as well. Those you see are really high on the face-to-face percentage and low on distance. And you'll notice there's all kinds of different options. And granted, I just want to give a shout out to those specialty programs and schools that exist and serve a lot of students in a variety of different ways. This slide, I've just made pie charts from those numbers, and here I did get the junior high right at 73.41. But again, you see even from this data visualization that elementary is a little bit larger on the distance. Another way to slice and dice it is by grade level. And again, you see that in elementary school, there's a higher percentage of distance than there are in secondary. Any other questions with those numbers? And again, those evolve every day. They move slightly. We'll have a better sense in a week or so of where they land. But I think for the most part, it gives you a sense of what's been chosen.
Thanks. Leslie?
Wait, Leslie, why are you cleaning up? That's Ben's job.
Ben's slacking over there.
I'm socially distant.
You know, in a very real way, we're a pod. So whatever germs
That's right. We are, if one isolates, I guess we all isolate.
Yeah.
No. Good evening, board. Thank you very much for giving me this opportunity. I just want to give you a little rundown on what we do when a case is identified in a school, kind of orient you a little bit about the different things that play for that. I've enclosed a flow chart, and obviously you can't read it, so I've broken down the flow chart. So the first thing that happens is an employee or a student has been identified as a positive case, either by themselves or a member of their household, test positive for COVID-19, or are notified to quarantine due to direct exposure. We report directly to the principal supervisor, the employee does, and then personal identities must be kept confidential with the exception of reporting requirements. We try really hard to only give that information to the people on a need-to-know basis.
What's direct exposure?
Direct exposure is they're living with someone who has tested positive. That's direct exposure.
But in a school context?
In a school content, it would be 15 minutes next to someone wearing a face covering, closer than 6 feet, obviously. But if you're 6 feet and wearing a face mask, then possibly not direct exposure due to the fact that you have two mitigating factors in play. Rather than, your face covering's one, and number two would be the 6 feet.
So who makes that call?
The health department does, and we take the lead from them. They guide all of this process on telling us who gets quarantined and how that works in the classroom. They do a lot of contact tracing to see where has this student been, who do they sit by. We pull out seating charts and look around each student to try and basically capsulize the process and remove that capsule from the system in order to stop the spread.
How do they do that with lunch and halls and all that kind of stuff?
Lunch, for the most part, and John can correct me if I'm wrong, a lot of that's outside. And right now with great weather, we're keeping our, quite a bit of distance. I visited Taylorsville High School, and there were kids, benches outside. Tons of social distancing going on.
That's attacking the 15-minute piece.
Yeah.
And then in the elementaries, they've got them every other seat.
Yeah, with
facing.
name tags about where they sit, on what number. The elementary people have done a good job systematizing that.
In the high school setting, though, they do oftentimes have to ask the students who they were sitting next to, they were interacting with. In the halls, passing times are 5 minutes from the brief passing. They're not interacting close to the other concrete line.
Thanks.
Okay, so then moving to the next part of the process, once they contact their principal or site supervisor, the principal completes an initial tracking document, and that document's sent straight to the lead nurse. They contact the designated lead nurse and their director both. They work with the lead nurse and the local health department to determine communication sent out to students and staff that may have been exposed. They also direct affected employees to contact benefits so that they can get some guidance that way through Berkeley King. And then they work with the custodian to provide enhanced cleaning in the affected areas, and they'll contact custodial services. So then either the principal will be duly correlating with the lead nurse as well as their director in this whole process. So let's define the role of the lead nurse. They investigate the report. They contact the health department as needed. They provide guidance to students and family. They provide an employee guidance letter, including directions for employees to contact benefits office for leave options. They work with the health department to provide next steps and communicate recommendations to the principal and site supervisor. And then they provide the latest information from the CDC and the local health department, as well as they coordinate with the school nurse. So there is this point of contact is a lead nurse. There also is a school nurse assigned to help at the school site to answer any questions, talk about symptoms for the faculty and parents, and for good reference to also their own healthcare provider for any concerns that they have. And then the director's role is to provide support to principals and on-site supervisors to coordinate with the school nurse and the administrator and site supervisor and the lead nurse. If there are any significant exposures and potential large school types of quarantines and isolation directives, as well as notifying members of the superintendency and other administrators as appropriate. If you look at the chart in its totality, once it's identified, the exposure goes down to the principal, and then the principal coordinates both ways with the lead nurse and with the director to help.
How many reports of exposure have we had so far?
How many reports of exposure?
Yeah.
For isolation or for quarantine or? Without exact numbers, maybe about 230. Yeah, isolation is a lot less. It's probably not even 100. I'm thinking like 60.
35.
It's 35? Okay.
And to be clear, those quarantining aren't necessarily positive cases.
No.
Those are students that have had direct exposure with a positive person,
Yes.
staff
certainly.
or student.
And those are all across our schools through staff and
Right.
students. So we're looking at 63,000 people. That's our number with that, which you look percentage-wise. According to how big our system is, it's not great. All right, any additional questions?
Since, Todd, since you just raised that, let me spend some time with that for just a minute, because that's an item. The local health departments this afternoon met with the state health department to talk about making public the different numbers, and Karen and I had a meeting this morning, and I'll talk about that a little bit some more here in a minute. But my sense is the last report we heard from the health department, because this is the granite sheet, but it doesn't show what's happening on the health department side, because there's a whole nother sheet, and the two stick together very tightly. Anyway, it looks as though, my sense is that the health department will start reporting positive cases by school, by number, when the number is higher than 5 or 7, and that's where some of the discussion was. So that at any given school, you'll be able to look and say, well, no, they're 0 to 4. They don't have, if they have any, it's fewer than 5, or they have 6 cases, or they have 7 cases. The three values that are in tension there. The one, as we talked about, public health really only likes to let the people know who need to know. And there are lots of people who think they need to know that don't medically need to know. So medically, from the public health perspective, the person who's positive needs to know, and the people who are around that person for the qualifying period of time, they need to know. But they're not really inclined to let others know, and so it's a little weird to them that everybody else really wants to know the answer. And so that's the value. The next value is the privacy of people. When somebody's got a medical condition, that's not something that, under the laws of our country, we really want to broadcast out to the public and let them know. So there's that piece. But the third piece that's in tension is the rumors are flying about who has it. I get emails every day, hey, so-and-so's got it, and so everybody that was sitting around them has it, and when we dig that through, so-and-so doesn't have it, but people don't know and they're worried. And so there's a real value. There would be a lot of value in being able to say to somebody who calls, how many cases are there in my school, to go through the report and say, none. And then they'd be relieved by that. So those three pieces are in tension with each other, and I expect that we'll get guidance from the state health department in the next couple of days as to what we can report and what we can't report.
Question. So what is the timing of this? I mean, we're on day 7 here. In 3 days, we've completed our first 2 weeks of school. I'm actually surprised that we don't have a system up and running. The start of school wasn't a surprise to anybody as far as the dates. So what is the timing that this dashboard would be up and going for parents to be able to even look at.
Well, the argument there is between the state health department and the local health departments. The state health department's getting pressure from the State Board of Education and from legislators and others to put this out. The local health departments are resistant to that because of the reasons that I just talked about. And I think that all came to a head this afternoon, and I'm just intrigued to see which way that plays out. So you're right. We all knew school was starting, and they all knew school was starting, but their dashboard plans didn't come together, and that's
Frustrating
yes.
is the right word.
Yeah.
So, okay. I haven't even spoken to board members about this, but question. We have a right to post numbers on our district webpage for our schools, do we not? I mean, I know they're coming from the local health, but is just putting this out there for board members. You can chime in if you disagree with me, feel free. But if it's as simple as listing the schools and listing the positive cases with no other information, we're not giving away any HIPAA things. We're not trying to pinpoint it. But if I have so I get calls, and the rumor mill is just rampant right now. There's a case in a school, and it might as well be 15, and the school is shutting down tomorrow. Because those are the kind of calls I'm trying to field, and I'm sitting over here, I'm like, I don't know how many cases are in that school. I can try to find out for you. But we're asking for parents and communities to work together with us, not sending their kids sick, which is a big problem right now. But other things, teaching them how to wear a mask, having good, safe practices at home, keeping their kids maybe not out partying with each other without masks and those kinds of things. But yet we're holding this information so tight that I think some families would appreciate knowing. So is it really that complicated? And even if it were just updated once a week, like either every Monday, every Friday, whatever, is it really that complicated to get the data without saying, even if I don't even need to know if it's staff or student at that school, but just numbers? Because you say the threshold 0 to 4. Well, to me, 4 positive cases versus 0 is a big difference. And if I could look it up at the school, I don't know. I'm just thinking out loud, but is it? We have a lot of comments. Let's start with Connie, Todd, and then Terry. We'll just go right down.
I got a phone call from someone who got a letter stating that, well, something was going on in the school, and I can see the conflict, but I also can see the school's point of view saying, yeah, but I can't say anything because we don't have anything positive. It's just that we can't do what plans have got to change at the school. And so I see the conflict, but I think people just, when they can give more information, they certainly will. So that's what I finally just told this person, that, hey, just rest. If there's more to this, then the principal will let you know. So I don't know.
I agree that if we have data and we're not sharing it, that we're going to get backlash. I mean, I think the parents want to know what's going on in the schools.
And when you say data, you're talking, I mean, just numbers. Just
if we have numbers from the health department, I mean, and we don't publish those and we have them, I think we're going to be highly criticized. And I think the numbers should be put up.
Terry?
I think we ought to follow the Board of Health, whether it be state or whether it be local, whoever wins out in this discussion, and follow their lead, and then if they don't give us something that's real good in the next week or so, we may have to make a decision. But I think they're still trying to work some things out based on what Martin's telling me. I guess we'll see who wins out, the state or the local boards of health, and then we go from there. But hopefully they'll give us some direction. I think it's real easy for us to say we don't have that information completely, and we're not allowed to give it out yet.
but we do have that information.
Are we allowed to give it out?
I have data from the health department. I'm reluctant to let their data out without their permission, because then they might stop giving me the data.
So let's wait till they
So
come to a decision.
that is my concern.
Yeah.
We aired that pretty strongly. All of the districts in the valley with our local health department today took them by surprise that we were more inclined to release data than they thought we were, or than they thought we would be. And so I'm
not hearing a lot from parents of that concern.
Have we asked them for permission to release it?
Oh yeah, that's what our conversation was this morning. Yes.
And they said?
They said, we're having a meeting this afternoon with all of the local health departments and with state health department. We'll get back with you in the next couple of days.
I think we just need.
So they didn't answer the question.
That's correct.
It was a good sidestep. And I do, Terry, you bring up a valid point. They are working on this. My problem is these county health department meetings have gone on for 3 weeks. And the last 3 weeks I've heard that they're working on it. And meanwhile, and so my big concern, just big picture is okay, when are they going to, first of all, decide who's doing the dashboard? And second of all, how much time does it take to create the dashboard? And then all of a sudden, if we're a month into school and we've got possible schools quarantined by then, or classes, or multiple, hundreds of students quarantined or something like that, then I feel like the cart's behind the cart's in front of the horse.
Are we getting a lot of requests from parents or frustrated parents? Not knowing? I haven't had any.
I've had a couple that have called and said, "Hey, can you confirm? I mean, it was a school in my precinct, and
the people who've been contacting us have mostly been, for lack of a better word, whistleblowers, saying, "Hey, there's a case over here. Hey, there's a case over there," letting us know of cases that they, first of all, believe are there, and are concerned that we don't know that they're there.
What I'm hearing is you're not getting a ton of parents.
No, the media wants to know. The media keeps calling.
Well, I think we just use some patience for a little while and let the Board of Health figure this out.
Well, and our message to them today was, we're actually really interested in being able to make this public.
And that may help them make that decision.
I think it would help parents be more vigilant.
That could cut both ways. I mean, a school could say, we don't have any, so our kids don't really need to wear masks. Or the message that I would hope would be communicated is, we don't have any, let's keep wearing our masks so that we keep not having any. So there's messaging that needs to go along with that. But I have data that's not generated from me, it's generated from them, and I'm reluctant to have them not want to share with me in the future because I've disclosed things they gave me.
How can they withhold it from us? And under what possible rationale would they withhold that data from our school district? I can't imagine one.
I have that question too, because they would have to be notifying.
But it could come slowly.
Kids. Come slowly. They want to stop COVID as much as we do. I mean, for them to drag their feet just because we're sharing information, that's crazy.
I'm not saying that anybody in the Salt Lake County Health Department is dragging their feet or threatening us or anything like that. We are working together very, very well. They were surprised to hear from us today that we were more inclined to release information. They thought they were protecting us, and we clarified that with them. They have been and will continue to be great partners. I'm just telling you, they've given us things which they feel right now is confidential, and I'm not inclined to release that without their thumbs up.
But that data is one of the only objective matrix that we have to assess the effectiveness of our attempts to mitigate. How else can we know whether anything that we're doing is effective or not without data? We keep saying that we're data driven,
Well, and
Well, give us the data so we can drive this analysis.
And they are. It's just, would we make that public unilaterally is another question.
I understand, but the public wants to know too whether what we're doing is effective or not. I mean, as a member of the public and with the child in school, I'm interested in knowing.
Yeah.
Speak into your mic, John, because we can't hear you.
We also have to be careful what we think that data is saying, because many of the cases that we have traced back where people are positive did not necessarily get it from school. Most of them are getting it elsewhere. So we have to be careful when we look at that data, because it may not be indicative of what's happening at school, but what's happening in the community.
But it doesn't matter where they get it. The matter is that there are exposures, the potential exposures in the school.
It does matter.
But we knew that those students would be out on the weekends doing all kinds of things
or afternoons.
Well, I think it matters because if you don't look at where it's coming, I think that would cause more confusion in the schools to be like more panicked, because they're all getting it from school. So I think that if the data goes out, it has to be very clear.
Schools are places that members of the community congregate.
Yes.
Where members of the community congregate. So it's not that this spontaneously generates at the school, but it comes to school from the community. And that's a messaging. But once it's at the school, then we've got to deal with it at the school. We're the Pleasant Grove High School had some things happen today, but few people are talking about the Pleasant Grove community. They're talking about Pleasant Grove High School. And I think that's what John's speaking to. That's a concern that we have. I can say unequivocally that we intend to work with the health department, and I think they intend to work with us to give the community as much information as we're able to give. Their meeting, I don't know when this afternoon,
Bonnie.
Yeah. I just want to say that I think we have a partnership right now with the health department. And I agree with Terry. I think we have now let them know that we want to have something public, but if they consider it confidential information, I don't think it's a good idea right at this moment to publish it. And I would rather be partners with them and encourage them to move forward in an expeditious manner. Is that a word?
Mm-hmm.
Rather than stomping on them and saying, I don't care if and let's just, I just don't see wisdom in doing that to a partner that we've worked with.
And to be clear, they are working their tails off. I mean, I don't in any way want to make it seem like I'm not, supportive of them. And these weekly calls have really been enlightening on how much is on their plates as well. I mean, we have a full plate, so do they. One thought, we can maybe look at this in a couple of weeks at study session, and just if board members, if you're okay with that, just give them a couple weeks. Let's see where we land with them and see if the dashboard's even created by then. Ben, you're communications director. Do you want to chime in a little bit?
In the interest of full disclosure and having a job tomorrow, I'd like to point out that I did release our total number of cases, both employees and students, which was 46 as of yesterday morning, to KSL this afternoon. And again, I reiterated and went back with Nick at the health department on what they would release, and he told me they would share that same figure. So I felt comfortable sharing that this afternoon. Yep. In terms of, here's the thing, if the health department, from my perspective, I do believe there's a lot of merit to what's being discussed here. I believe that erring on the side of transparency will actually benefit us. There's going to be people who will be panicked because of the information regardless. And so I'm thinking of the 80% of people who will say, oh, I'm glad it's not 11 cases, it's just one, that are going to look at that in a more reasonable fashion that we should be focused on our messaging for.
So is that positive cases? Is that what the 46 is?
Yes, and to Leslie's credit, I pulled up her report when she got asked a little bit earlier and looked at the actual figure based on what we're gathering from the health department.
Yeah, I'm okay being patient, I guess, for a couple of weeks, but I do think as elected officials, we owe it to our communities to be as transparent as possible. I don't want to do anything that damages the relationship. Connie, that's a great point. You know, I mean, you're right on. We need to work side by side, hand in hand, but if we're both sharing, if they're giving us that data and they're okay maybe sharing it a district-wide, maybe we can communicate, and we have communicated, but maybe even more so, hey, we'd really like to put this on as a breakdown to kind of, it can incite panic, I recognize that, but it can also, how you really calm rumors is with accurate information. And so if there's people thinking there's 10 cases at a school and it's 0 or 1, that's a huge difference.
Yeah.
Could I just add a little bit more information to the context of the discussion and information I might not have shared with the superintendent quite yet, so I apologize in advance. In my discussions with the health department.
Well, I don't know which way the meeting went. You may know which way the meeting went. So.
And again, hopefully I'm employed tomorrow. In my discussions with Nick and the health department, their plan is to release the data at the school level. And it's looking like they're leaning towards simply indicating whether there's a greater threshold than 15 cases or less than 15 cases. But that's what they're looking at right now, and that dashboard could be released as soon as next week. But I've been hearing, with due respect to my friends at the health department, there's been, again, because of what the superintendent's inclined here, how much and what do we share? That's what I've been told as of this afternoon. So it would be, I'm a little more in favor of giving out more information than less than 15, because less than 15, 1 is a whole lot less than 15, if you know what I mean.
Well,
and 14 is the same as 15.
Correct.
Yeah.
For the same reason.
And as soon as we hit that 15, then all of a sudden the statement isn't how many cases you have, it's the school shut down.
Yeah, everybody knows when you get to 15.
Everybody, but I don't know. I guess I'm more in favor of putting it out there without wrecking relationships. I think Martin, Connie, everybody who said that, we need to maintain our partnership, and maybe there's a formal ask that needs to be made that, hey, can we get this information out with your blessing, so to speak, not doing anything or behind their back or to upset them in any way. But I
don't have a problem with that.
Right.
As long as it's upfront.
Yeah, we need to communicate. We absolutely need to communicate with them. I think, when you're dealing with infectious disease, obviously there's HIPAA with everything, and we need to be careful of that. I don't see a lot of people walking around fearful of getting measles or even influenza right now. It's all the massive fear that is surrounding COVID. And so I do think that we have to treat this a little bit different in our communication. Once again, not giving anything away, HIPAA or any indication of who, employee, staff, student. Anyway, I just wanted to bring that up because that is a concern that I can see would be maybe really important to our parents and families going forward as these cases start to have a little bit of an uptick. We're already at 46, but we have no idea where across the district where those 46 even are. So if we don't know, you can imagine how our communities and our families and students are feeling that they also don't know where they are. So
if there was a question in my mind about how our Board of Education feels, there's not any longer. And I will personally make sure to communicate that to the health department and say, how can we get this direction? How can we make this happen? And we'll look to them for their thumbs up to do that. Just a little more report. Karen's alluded to this. Was it our 4th meeting today? I think it was our 4th meeting today. So for 3 weeks, 4 Tuesdays in a row now, we have met for just about an hour in all of those meetings. It's been a board member and the superintendent from all 5 of the school districts in the valley, and the director of the Salt Lake County Health Department, the emergency services director, and their medical, Dr. Vitek is their epidemiologist, and others from their staff, including some of the main liaisons with our staff. We've talked about numbers. We've talked about thresholds. We've had these very kinds of conversations that we just duplicated here. It was kind of a very similar conversation this morning with a different group of people, and a charter school in Utah in Salt Lake County was closed today. When I say closed, put on dismissal. That was the south end of the county, American Preparatory Academy, Draper School.
The Draper campus. Yeah.
And we don't have any schools in the county that have met those thresholds, and certainly not in our district either. Anything, Karen, that you can think of specifically that we'd want to share? But we're on again next Tuesday at 7:30, and that's again a high level group, because I know that our nurses and their counterparts, they meet telephonically 7 days a week, 24 hours a day. And unfortunately, and this is another piece of this, unfortunately, that then rolls into our principals, because our principals need to start notifying people on a Sunday afternoon or a Saturday afternoon when they pick up this information. So we had a lengthy discussion today about how we can support them. So we had an elementary school that needed to let 20 people know that they needed to not come to school the next day in terms of quarantining. And in the communication that went out, it said, please respond that you've got this. Well, they didn't all respond. And so that principal then needed to contact a dozen or more families to make sure that they got the message. And if that's in a larger school, in a secondary school, when you've got 3 or 4, in a secondary school, when you've got 3 or 4 kids, because they go to 7 or 8 classes and have 8 or 9 people sit around them in each of those classes, now all of a sudden that turns into a big number of people who may or may not be responding to the emails that they've been noticed or been notified and want to have their child come to school the next day. So that's another piece, and we're working to put together a district team to assist schools in being able to accomplish that in the event that that's necessary. So that's our report on what we've been speeding down the highway with these first couple of days of school.
Wow.
All right.
Thanks for all your efforts.
Thank you, Terry. We do have
May I ask one follow-up question? Out of that 46, how many were teachers?
9.
All right. So any other questions regarding this first week of school update? All right. We do have need of an executive session for the purpose of litigation. So I will entertain a motion for that.
I move that we go to executive session for
Litigation.
I'll second.
All right. We have a motion and a second to go into executive session. This is a roll call vote, individual vote needed. Terry?
Yes.
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 Nicole?
Yes.
Okay. All right. Thank you.